Hey, listeners of A Tale of Two Hygienists. I have a couple things to tell you. My name is Alan Mead. I am co-host of the Dental Hacks podcast. Now, you obviously realize that you are listeners to the greatest dental hygiene podcast that's ever been created in the history of all time. I need to tell you about the greatest podcasting meeting that's ever been created in the history of all time. First off, you need to know the Voices of Dentistry is an innovative meeting. It's a blast. We have a lot of fun. Andrew and Michelle are going to be there. I'm going to be there. A whole bunch of dental podcasts are going to be there. Basically, all your favorite dental podcasts are represented. We have an amazing speaker lineup, including Dr. Jameson Spencer, Dr. Mark Costas, Dr. Baron Grutter, and Dr. Corey Glenn, Dr. Danny Domain, Gary Takis, Rachel Teal-Wall, Sandy Pardue. The list goes on and on. But more than that, we have a great party. We have karaoke. We have live podcasting all over the place. You can get to meet and actually podcast with some of your favorite podcasters. This is an event not to be missed. I want you to go check it out at voicesofdentistry.com. It's just a few weeks away, January 25th and 26th in Scottsdale, Arizona at the Doubletree Resort. It's going to be a great time. It's going to be bigger and better than ever. And frankly, you don't want to miss out. Again, listeners of the greatest hygiene podcast in the world deserve the greatest dental meeting in the world. Go check it out. Voicesofdentistry.com. We'll see you there.
Get ready for your unofficial dental hygiene podcast. These are the tales of two hygienists, one East Coast RDH and one West Coast hygienist. Listen as they tackle the profession of dental hygiene with humor and enthusiasm. Now, please join Michelle Strange and Andrew Johnston as they tell you a tale of two hygienists.
Welcome back, everyone, to another episode of A Tale of Two Hygienists, episode number 152. My name is Andrew.
And my name is Michelle. We welcome you back for another week. Thanks for returning.
Yeah.
I'm sure it's because you think this Airway series is just so awesome.
It was. I mean, It currently is a state of being that is not past the tense. Everyone's been loving it so far. I mean, we've gotten a lot of good interaction. I think this next episode that you're going to listen to today, though, is, I think, just one of the most amazing things. We're going to be talking about like the stages of life and how Airway affects even from like the fetus, like before the baby is born, all the way to when you're an old person, a very old person.
It's fascinating, and I said it last week, and I'll probably say it every week and every moment I talk about Airway. But once you start learning this, you can't unsee it. Like you see it in everyone's face.
Yeah.
And of course, I'm that super annoying friend that's like, how do you sleep? Hey, does your kid have a hard time sucking on this?
It's so interesting. So these last few weeks, I've really been talking about it a lot more with my patients. And, I've discussed it with my doctor, hey, look, I'm really high on this right now. This is like amazing. It could unlock a lot of things. I just want to give you a heads up. I'm going to be talking about this with the patients. And he was really cool with it too. He's like, sure, yeah, whatever. And now we've been talking a lot more of the referral side of things. Like, okay, now I want to go out into the community and say, which of my providers in my area do I want to refer now to if that is like the next step that we should be taking? Because right now it's very much, and I think Julia and Cyndee kind of mentioned this, but right now it's, hey, go talk to your medical provider and see if you can get a sleep study done through your insurance and stuff like that. That's kind of where I'm still at right now, but I'm super energized to figure out, like, can we make this bigger? Can we bring more of like the medical people into it? And how can we really collaborate in our area? So very
That's
excited.
interesting because I'm kind of doing the same thing. Literally yesterday, I posted in our local Facebook group and I was like, who's treating tongue ties? Who's assessing airways? Anybody doing myofunctional therapy? Like, where are my people that I can refer to? And I actually met with a dentist who is just amazing. I actually met him yesterday for tepe stuff, but we started talking about Airway, and he is like starting to teach this in his curriculum at our medical college. So I was like, what? Amazing. So it's like, get on board. Like, go, like, come on, get on board, because everyone's going to be moving towards that. And there's some hurdles still too. We were talking about some of those hurdles with medical billing and things like that, and finding people and feeling confident in their ability to care for your patients once you have assessed them. Like, I think that's going to be I mean, that's kind of always the thing. Like, do I trust that orthodontist? Do I trust? And now we're going to have to be like, do we trust that medical provider? So it should be interesting, but it's very cool and very exciting. So we hope everyone is enjoying this as much as we enjoyed recording it.
Well, and I think that, the evidence is saying, all people are responding to it. People have been interacting with us on social media and things like that. And I can't, with this particular topic and with all of the topics that we ever talk about, I can't say thank you enough to all of you out there who are messaging us or emailing us. I think Michelle has an email she's going to read here in a couple minutes. We really appreciate the interaction, but I think even more than that, we appreciate the interaction that you have with the guests on there, and feel free to email them and contact them, because they really are the experts and they'll be able to help you in so many ways.
Totally true. And actually, this is a perfect segue into this email, because this email came to us and I'll read the first part of it, but the end of it was wanting to be in contact with one of our guests. And she had a question. And so we kind of put her in contact with that guest. And I just love that. Love that. And it was Amber Riley who gave a response. I was just like jaw dropping. I was like, you took so much time and you know so much. And thank you so much for engaging with that listener. It was great. So this is actually from Vivian. It says, "Hi, Michelle and Andrew. I super love your podcast and have been binge listening for the past 3 weeks. Not only am I learning, but your podcast always makes my passion for hygiene reignite. And after 33 years of hygiene, that says a lot. I feel like at this point in my career that I'm winding down, but I love that after I listen to a podcast, I feel like I'm that current hygienist who's just graduated from hygiene. Thanks so much for your time and work that you give to us all." 33 years, and now she's learning, or not now, but she's like re-engaging in a new way. Because podcast is kind of like the millennials' way of learning, right?
Right.
And I love these people who've been in the profession for, let's say 20 plus years, that are engaging in all the ways and learning and just having their fire fueled again. I love it.
So thank you, Vivian. Thank you also, Amber. Amber, I can't wait to see you. We're going to see you at Chicago Midwinter here in about a couple months.
And I'm going to Chicago Midwinter now.
Oh, yeah. Hey, what's up? Change of plans again.
Change of plans. I wasn't supposed to be at Midwinter, so you will find us both at Midwinter and at Yankee, at the Yankee Dental Conference. So if you're going to be around, let us know. We'd love to see you, hug you. I'd love to drink wine with you.
And I'll watch.
Yeah. So enjoy this episode 2 of our Airway series with Julia and Cyndee.
Hey, Michelle.
Yeah.
It's time for the interview.
Oh, but I had something else to say.
We need to let the experts talk now.
Fine.
So we are now on episode 2 of this awesome 4-part series on Airway. Today we are going to be talking about the stages of development. But before we get into that, I want to welcome back, of course, Cyndee and Julia. You two bring an awesome dynamic as a team, and I was hoping that you guys could speak to that a little bit.
Thank you. Thank you for having us here. This is so fun. The interesting dynamic is Julia and I both have a passion for increasing the level of care and integrating medicine and all levels of health care into one.
It is an interesting collaboration, not just Cyndee and I, but medicine and dentistry. And the divide that has occurred for some reason is really, now we realize, is harming our patients. And so when Cyndee and I first started to chat about the correlation between nursing and hygiene, we realized there's a fantastic opportunity there. Because while I might have this knowledge about sleep and airway, that knowledge does no good if it just sits there and can't be implemented into a dental office. And so what Cyndee brings is this many years of experience of implementing comprehensive care in a dental environment. So really, it's a perfect synergy for us to be sharing this information, and then with you guys taking it mainstream through your podcast. So I love the synergy that's happening.
Yeah, truly. Too. And I agree with everything Julia said. The comprehensive level of care is so important. and taking it outside of, I think always keeping our lenses just at the widest view possible. And while we want to be having our teams integrated and understanding these things, we also want to remember our teams that are outside of our roofs, outside of our four walls, which are the physicians, the therapists, the ENTs, the cardiac doctors, all of them. They're all part of our team. And I think where we both have the synergy is we believe that we're all working together. And these silos are, they need to come down.
Yeah, they're
They need to come
dangerous.
down.
Absolutely
Yeah.
agree with that.
And then just so your listeners know as well, the work that we're doing with hygiene, we're also doing with respiratory therapists, speech language pathologists, lots of work with nurses. And so really, if we can just get into our mindset that if we are a provider that sees patients, we are responsible to address their airway issues. It doesn't matter who you are. And then being able to communicate with one another. So, if I'm a nurse and I see an issue with my patient, they're having sleep issues and they're not able to wear a CPAP, how do I call your office? Who do I interact with to pass that patient on to you? Could you look at their craniofacial structure? Could you maybe make them an oral appliance and help them with that? So the networking becomes a huge issue, and we can't do that if those silos remain.
So today's topic is going to be on the stages of development. So where should we start, and where do you normally start with all of these groups when we're talking about this?
What's interesting is in the medical community, we seem to start just when somebody falls down and has a problem. If we could back it up and start from right when a mother is pregnant with that fetus, we could do so much to prevent the disaster that we're seeing in our communities today. There's a lot of information out there about the fact that a mother who's pregnant, and especially in the third trimester, once they've put on extra weight from the baby, they've got extra fluids in their body. There's all these things that are taking place, but we can see changes in the developing fetus if the mother has an airway issue. If she has sleep apnea, maybe she wasn't aware of it before, maybe she didn't even have an issue before, but now that there's those factors, she does have it in her third trimester. If she started the pregnancy already having a sleep issue, then we can see changes in that baby within the first few weeks of development. On ultrasound, you can see changes in the vasculature. You can see that when the mom stops breathing, the baby stops breathing.
That's scary.
Yes. So even the wiring of the brain of that child, because it will start to panic and be responsive to the fact it's not getting oxygen from the mom. So right in utero, we have a chance to really impact that child's life. Otherwise, we're scrambling to catch up when that baby's born.
And then I'm sure from a developmental standpoint, so if they have the sleep apnea, would you call it sleep apnea in the womb?
Interesting. So the mom has the sleep apnea, the baby would have hypoxia.
Ah, okay. So if they have hypoxia, are they more likely to have that have sleep apnea when they're born?
Excellent question. Yes, because during the third trimester, that baby should be focusing on building the muscles of the face. So they should be practicing their sucking. If you see those 4D images or those ultrasounds, right, where they're making facial expressions, they're grimacing, they're actually working the muscles of their face to prepare for breastfeeding. We know that babies that are born to mothers who have sleep apnea, when their facial muscles lack tone. So they're going to have difficulties with feeding when they're born. Because they have difficulties with feeding, we want to jump right in and solve that. So we'll supplement and maybe turn to bottle feeding, or we'll put a tube down so that they don't have to work as hard on the mom's breast, but they'll still get the nutrition. And we focus on the nutrition because we want to make sure the baby's gaining weight and all of those issues. But at the end of the day, what it does is further weaken those facial muscles. They need to work those muscles to build the jaw for the face to grow forward. So it's like this cascade of events that takes place that started in utero. So what's fascinating is the more you learn and the more you get involved in the airway world, you'll learn all sorts of techniques for helping that baby, for guiding it, for helping to stimulate the facial muscles and promote growth. One of the things, I brought a couple of things to show today, so I'm just going to show you this. So for example, the suck swallow, how important that is to a baby. And there's this product where it can help to, rather than a soother, which then perpetuates this, like a bottle would, like a thumb suck would.
Pacifier.
The pacifier, how you start to get the arch
Up.
being vaulted and narrow, and you start to get more crowding of that airway. We can guide growth with devices similar to this, where the baby would chew into this, and as they grow, you would just be replacing it with a larger and a larger one
Okay.
to help guide that growth and keep that arch expanded, right? But you're going to prevent a lot of issues down the road if you guide growth in that child.
Julie is speaking about an infant here. What is a
Yes.
question that we're asked in dentistry by moms and dads all the time?
When do you bring the baby?
When do I bring
Oh
my
my
child
goodness,
into the dentist?
yes.
And the answers to those questions are all over the map. Bring them when their first teeth erupt. Bring them when they're 6. Bring them. We all know that there's no consistency. And what we're learning here is the significance of bringing that newborn baby in to see the dentist.
This looks like a dog toy.
I know.
It's like something I'd give Lola.
The thing is, in some other countries, the visits for that baby occur prenatally. So the education is provided to the mom then, and then they are seen within the first 3 months. And you think about tongue ties. Back in the day, the midwives used to have a long fingernail. When that baby was born, they would
Where are
just
you going with
snip that tie.
Oh God, that makes my mouth hurt thinking about that.
Well, they would do it right at birth because they
Uh-huh.
knew if that tongue was
Okay.
tethered, then there would be all sorts of issues, right? We look at, I mean, there's just so many fascinating facts. I want to just throw
Throw-
out there,
yeah.
but like even SIDS, for example, the correlation between tongue ties and SIDS, the correlation between
The upper frenum, the maxillary frenum.
it's like 92%. So that what they did is they took 400 children that died of SIDS. 92% of them had that tie. So when you look at, I always struggle with this. Embryologic, is that even a word? You know what I mean? Okay.
Yeah.
So you look at the development of the embryo and how it kind of unfurls, right? That
Yes.
baby unfurls. When there's tethers, that fascia is not unfurling properly. That child's going to have issues. The adult will have issues, back pain, neck pain, whatever, related to the fact that this did not unfurl
Like
properly.
release in the
Yeah.
proper way.
But
right?
anyways, I could get
Yeah.
totally off track, so let's stay.
So if I can go back to this, because I don't have children, my vast knowledge of babies' mouths, but this looks big.
That is big. That's a toddler size.
Okay.
That would be toddler.
So at what point is it a good time to introduce something like this?
So you would, so here's the thing. You would look at your child, what are the issues? There are devices that you can use in infancy, in breastfeeding, that you would put on the child's upper palate while they're nursing.
Oh.
Okay, they use it while they're nursing. So no teeth to hold into it, whatever, but they do an impression, they take there's a whole world that will help to guide growth from infancy. If your child's a thumb sucker and you want to switch it out for something. If you discover the world of Airway and you realize the pacifier is not helpful and you want to switch it out. There's a few different companies out there that make different appliances, and they go right up to teenage and some even adult to just you use it while you sleep. So it's like a passive expansion while you're sleeping. Every time you swallow, you're working that during the night. We don't have to wait until a child's at the point where they need braces and we need to undo all this damage. Christian Guilleminault, who is kind of the father of pediatric sleep apnea, talks about expanding, looking at age 4, 7, 11, making sure that we are keeping this palate expanding. Obviously, the tongue work that goes along with it, you talk about myofunctional therapists to help guide that. If we're talking about infancy into childhood, the whole tonsil and adenoid connection. A lot of what parents are concerned about is the child's tonsils are enlarged and it's occluding the airway. There was a time where everybody had their tonsils and adenoids removed. now it becomes a challenge to get your tonsils and adenoids, and it's gone out of favor, if you will. So there's two sides to that. Because one, ideally, if that child is breathing properly through their nose and is not a mouth breather, you're not going to get hypertrophy. You shouldn't get hypertrophy of the tonsils and adenoids, okay? The turbulent airflow that occurs when you open your mouth and you start breathing through there. The fact that the tonsils are taking over the work now of cleaning the air before it goes into your lungs.
your
versus
sinuses
your nose.
and
Yes.
Yeah, okay.
So there's
makes
that
sense.
connection. So if the tonsils are kissing, and they're occluding that airway, we want to get those out. If a doctor denies the parent and says, we're not taking those out, parents freak out. What can we do in the meantime to support the inflammation to go down, right? There's lots that we can do. Alternatively, if we do remove those, we do see a resolution of the sleep apnea symptoms. What worries me about that is it's a temporary solution. So the studies say that if you do that and then you don't follow up with the expansion and the tongue being in the proper position and the lips being closed and breathing through your nose, you're going to get sleep apnea later. But the parent thinks they've dealt with it. I see that a lot. They think they dealt with that and they were fine, and they think they're going to continue to be fine. But the problems that cause the tonsils and adenoids to become enlarged in the first place are still there. So that is where the education needs to come in. That is a stopgap measure. It's not a permanent solution.
Well, I think it sounds like physical therapy in a way.
It is exactly
Right,
physical
but for your airway and breathing and
which is
facial
called
muscles
oral
and
myofunctional therapy.
Yes.
Exactly.
And it's also about helping to guide these mothers, these parents, these patients into the right hands, because we're all well aware of the fact that children will go to their doctor and they're sent to an allergist and they're put on allergy medications because they have these breathing issues, and they spend years on these medications not addressing the issue. Meanwhile, we all know what's happening to the brain development during that period of time. So really, not only bringing these healthcare professions together, but also helping to work as a team to find these people who understand this, so that we have a place to send them, because it's not always the healthiest move to just send them somewhere.
yeah.
You need to know where.
Is there ever a danger for, let's say, all the hygiene moms out there, like, well, I know my kid needs this appliance that maybe isn't really indicated, maybe they're being a little bit too aggressive? Is there a danger for someone using something like this when there's no real issue?
I
can't imagine.
I can't think
no?
of one. But that's a great
Heard
point,
of
because
it.
we self-treat a lot of, oh, we need this or we need that. Yeah.
Yeah. And I think there's a reason why in healthcare we don't care for our loved ones. I don't know if it's just, I mean,
No, it's,
Like mom goes
Yeah,
somewhere
yeah,
else.
yeah.
right?
Yeah.
We do, but we're ideally somebody looking at. I'll give you a perfect example. I travel a lot. I meet a lot of different people, and I'm with a lot of experts in this field. There's been several times where when I go and I meet the family of an expert, for example, I'll say, what treatment is your child in? Or your wife? And they look at me like I have three heads. What do you mean?
Yeah.
And it's clear to me there's an issue. But when it's somebody you care about and you love and you see them every day, you don't necessarily see the whole picture, right? So I don't know if I'm answering your question, except that my fear would be that you would treat with something you learned about point A without fully understanding the other aspects, and you'll get results, but they'll be partial results. And if we're going to do it, why wouldn't we do it in a coordinated manner? And so that's the thing. I mean, I'm sure you've heard of people who've had orthodontics only to have them done again, or maybe again. Well, because part of it was missing, and that's how it goes, right? That's how we learn. But
Well, that's
Can I
the key.
back-
It's how we learn.
It's how we learn.
It's how we
Yeah.
learn.
I want to back up and just cover two other points before we move on to the next stage of development, because I think they're
Yeah.
important. Breastfeeding. We all know we encourage breast is best. It's a sensitive topic. And you cannot assume that if your patient is not breastfeeding their child, it's because they're a terrible mother. There could be so many reasons why that mom is not breastfeeding. And it could be that we are triggering something that doesn't need to be triggered. So yes, we want to recommend breastfeeding, but we want to be able to say, if you can't or choose not to, here's how we're going to support your child, so that they don't end up with the issues of that. So that's why one of these things, okay? So the mom can't breastfeed, but we know that working of the jaw is important. It stimulates dopamine, it strengthens the muscles, it da-da-da. So what I like about one of these products is that it stimulates that chewing mechanism and helps to build the jaw. There's a place for the tongue to go, to teach the tongue to go into that position. So, I mean, the products that are out there have been very well thought through, depending on what the situation is, okay? So,
No, I think that was a good point to bring up, because you also got adoption, you have surrogacy,
Yes.
there's so many
the mom
things.
could have had breast cancer,
Yeah.
for all you know. It doesn't have, you know, there's so many issues nowadays, we're just not aware.
Right.
So we have to be careful not to breastfeed shame, all right? The other thing about the allergies, again, so many parents are thinking their child has allergies when it's the child is a mouth breather. And it's funny, when you point out the mouth breathing, they say, no, they don't mouth breathe.
Every parent I've ever brought it up, they like, no, I don't think my kid
No,
is.
they don't.
Or they have, I've even had somebody send me pictures of them sleeping with their mouth closed. And I'm like, but that's a snapshot of how many hours.
Yes.
But it's like, how do you...
So,
Sorry, I'm kind of digress there,
no,
but
no,
that
I
is
think
exactly
right.
that's
where...
exactly my point. You know, maybe during the daytime, mom doesn't notice, but at nighttime you see the baby's head's tilted back and the mouth's open.
Yeah.
So
Right?
let's touch on that for a moment. What in society does that signify in many people's eyes, right?
So are you kind of going down that like mouth breather?
I
like,
am.
Yeah.
I am.
Because I've never heard that before. And I don't know if it's just in my area as
Okay.
that being
Yeah.
a pejorative kind of statement.
Well, and maybe someone that's not so bright. And so we have these social, I mean, again, it goes back to, there's so much to this,
Right.
psychology and medicine and every other attribute, but it goes back to some of the societal
Yeah.
mores about certain things. So we don't want to let the world know that our child has behavioral issues. We don't want to let the world know that our child's a mouth breather.
And so we put them on medication.
So we put them on medication.
And we already discussed in episode number 1 what happens when you put somebody on allergy medication. Now they're not getting the RAM. They're not getting now they're running into behavioral issues at school, learning disorder. You know, all those. It creates a whole issue that we run into then when they're a child, 8, 9 years old. So what do we do at that point? Then these are the kids that are struggling in school, are being diagnosed with ADHD, can't sit still, you know, all of those issues. And so we take a toddler who is having a meltdown, and as a parent we say, okay, what time is it? They clearly need a nap, right? We recognize that. We put them to bed. But that same child at 8 or 9 that's having a meltdown or out of control, we say there must be something wrong here.
Not that
And
they're
we-
tired.
Yes. Where the studies show 80 to 85% of kids being diagnosed with ADHD actually have an underlying sleep disorder.
Hell, I'm like that.
Right?
36. I'm like, when I have a meltdown, I'm like, it's because I need to sleep.
I need my tape. I need my eye mask.
And you think about, how do they treat somebody that has ADHD? They give them a stimulant. So that child that's fatigued but is acting all crazy, they give a stimulant to wake up the brain so that they can focus. So we're getting it all wrong here, because if the child had the appropriate amount of sleep, the brain would be able to focus. We wouldn't have to stimulate that. In adulthood, what do? We take a coffee.
Yeah.
We have a coffee to keep going, right? To stimulate us. So, we're the whole dynamic of ADHD right now is spinning out of control, and it's our children that will pay the cost for that.
Something that popped in my head that I heard in a course a few weeks ago with Trisha O'Hare was when babies fall asleep and they always have like that jerk moment, you know, where they like wake themselves up or whatever. She said that that's a little bit, and hopefully I'm remembering this correctly, but that's a little bit like what's happening when they're in their chair, the little 8-year-old that's trying to stay awake because his body is going to maybe these micro sleeps that you were talking about earlier. And they have to jump, but it's very aware of in that moment, I guess, like, and you see it versus when a baby's kind of going to sleep.
Yeah, children definitely become more active and act out, and over time we are socialized to rein it in and act more appropriately in public, but it has a greater effect on us physiologically. So we have that internal stuff going on, just we socialize to not act out in some cases, right?
Right.
In other cases, no, we see the child becoming a juvenile delinquent, and then we see people in trouble with the law and in the prison settings and all that stuff, and we look back and we think, here there's been issues missed all the way along.
Yes, and we like to look at a timeline with whatever we're doing. Helping professionals understand that we have an opportunity to help our patient and to be very aware of at what point on their life's timeline are we capturing them. And we can look back at all sorts of treatments, conditions in dentistry, in fact, that we deal with, and ask ourselves, boy, if I had only been aware of caries management and really integrated a system for that, mightn't we have caught this patient at an early enough time that they're not in here having decay chase down their roots at 90? And to speak to that with teenagers and sleep and ADHD, that also happens to be the window of time that we're putting them in orthodontics. So many of these children are now, so they have these issues, they have the medication issues, the behavioral issues, the inability to really manage this, but that's another subject. And so then we're straightening their teeth or pulling them back and exacerbating conditions that we're not treating because we didn't know or capture or take the time on that timeline.
That's a good point.
So that's another.
Yeah.
I think, as it turns out, most of the interventions in the dental world, I believe, my personal belief, is that they're related to airway. Because you look at even the cavities in the front teeth. Well, they want to say it's because the mom's breastfeeding, but moms have been breastfeeding their babies for eons. Why are we seeing issues with this? I think it relates more to the fact that people are mouth breathing. Our kids are mouth breathing, and the saliva gets dried out, or
the buffering capacity is kind of gone because the mouth is dry.
And our diet. I mean, gosh, there's again our diet. Our diet is squishy, soft food. We don't hand a small child a wedge of an apple to chew on because we don't want them to choke, and so we're just exacerbating this at pretty much every turn. It's like a culmination
of a lot of things.
We give them a fruit in a squeeze bottle so they don't have to chew anything.
And the convenience side of nutrition.
I did a timeline one time to look at all of these factors that come together, and you look back to the First World War, the men go off to war, the women went to work, and all of a sudden now are trying to manage. And so the changes that we've made, and we were talking a little bit about, in society, have created this disaster that we face today. So backing up, and probably Uche probably would be, be all over the sugar intake and all of those things, right? So the culmination of these things we're trying to unravel now. What does hygiene have a fantastic opportunity to intervene with that will act in such a dramatic way? Is guiding that craniofacial growth, understanding the importance of guiding that growth forward, helping orthodontists to understand you never ever pull back. If you're a class 3, it's not that your jaw is too far forward, it's that your maxilla
is too far back.
And so why is it back there? Because you're not using your nose.
Your sinuses aren't expanding, all those things.
The bone will grow when you're using that nasal airway the way you were meant to. It will grow forward. Okay, I'll share with you something I learned at a conference recently. So you think of cleft palate. And they do these dramatic surgeries and they improve the look. Well, Dr. Singh has a paper out that showed just by ensuring the nares remained patent, they didn't have to do the surgery. It grew, it continued to grow and repaired itself. And all they were left with was attaching the skin on the lip. When it was a 1 millimeter gap, then they sutured that. So if you think about the power, whereas a lot of times the nares that become occluded because they put a device in there to enable them to feed, they just make sure they can breathe through their nose and the gap closed. That is significant growth that's occurring. And that growth can occur at any time. If we switch that child over from mouth breathing to nasal breathing, you will begin to see changes in their whole face and in the structure.
At what point does that stop? Like, could
Oh,
I?
that's a great question.
Like right now, because I am a mouth breather, I totally am. So could I change my face by becoming a nose breather?
You can change your face in many ways structurally that many people still today don't believe can be done, and that involves expanding the sutures, releasing the sutures. But yes, and that's one of the fallacies, is we think that we have these windows of time that we do certain things, but we can really accomplish a lot now.
That's the beauty of science and technology, and as we learn and we grow. So if you're still practicing with the science of even 10 years ago, you're doing your patients a disservice, because as long as you are growing cells, if you cut yourself and you don't bleed to death, you're able to repair, then any part of your body can repair itself.
I have a few questions about that Munchie appliance. So with that appliance, would they need to deal with tongue ties, freedom attachments, things like that before that's introduced? Because I actually had to touch on is this dangerous if I don't have those other things, and we're kind of self-treating, like we find something like this on Amazon or something. Because some of them will.
So the ones that are sold on Amazon are the ones that obviously anybody can use. The professional ones are only sold professionally. But having said that, when it comes to tongue tie, the recommendation is that they do myofunctional therapy and that prep work first, and then during healing, and then after. So could you just use an appliance? Would it be dangerous to not? No, you're going to get some growth, but you're not fully going to get growth, nor will you be able to sustain it until you do the other work.
And if you want to see what all the appliances that we're talking about in this episode, head over to our YouTube channel, A Tale of Two Hygienists, so that you can actually see the video where we're touching and feeling and playing with these things.
That's great.
Yeah. And then, so moving into adulthood. So have we kind of like finished up with the teenagers and ortho? And I love that you're talking about like the face changing and growing, because I mean, we're not extracting first molars or premolars much anymore. Like, you don't see that. But that was such a thing of the past.
It's still happening.
It is still happening. And the great news, so with all of that, there's still fantastic things that are happening. There are specialists and experts now that are putting the teeth back into their proper position and replacing the teeth that they've removed in the past. So actually giving the patient back what's been taken from them. We all know the beautiful smile, and we all know you can go into some towns and see everybody has the exact same one because there's one orthodontist in town, right? Yet each of us is so individual. But that's happening, and that's very exciting.
Oh, that's an
so
interesting
there's some
thought, 'cause I've never even thought about that. Having the same bracket system, the same wire, like everything is the same, and you all look the same.
Yeah, but we've all seen it, I think. Go ahead, Julia.
And I think, just touching briefly on the teenagers before we move on, and I know we talked in episode 1 about teenagers and sleep and all those types of things, but it's such a, as Cyndee mentioned, this is the time when they're dealing with so much stuff in their life, and then now we're going to put braces on them, and it's impacting them. We have the opportunity here to, first of all, guide to avoid that, but also treat in a different way that can still, support their self-esteem and those types of things. And we have an opportunity now, as we're learning more about this and supporting the important role of supporting those arches, it also becomes important during sports. And so that could be a whole nother topic actually, but the whole world of mouth guards, not just for the sake of protecting teeth, but for really preserving brain function, decreasing risk of a concussion, how you can support the cranium during those sports, those impact sports, to minimize damage, all of those types of things. I think that's something worth chatting back about. But the text neck thing, the forward head posture we're seeing in teenagers, the degeneration that used to occur when people were much older. When you'd see it in middle age and senior. We're seeing it in kids nowadays. So you're looking at postural changes that occur with an obstructive airway. We start to see it more significantly in those teenage years. And so think about the universal sign for choking. When somebody's choking, they put their hands around their, right? And they lean forward with their head. When that airway is occluded slowly over time, you see a slower forward progression of that. So a lot of times we're correlating it to them being on their cell phone.
Right.
But you can't just quickly dismiss. It may be, okay? But you can't just assume that without first assessing whether they have an airway issue. Because all the physio in the world to encourage you to straighten up your brain, once that airway open, it's going to force you forward. So you're constantly telling your kids to stand up straight, stand up straight, stand up. That should be a red flag. Why the normal position should be to be straight. So if they're not, what's happening there?
And then when you look at sports, I can imagine like how that trickle down effect of not having that good posture. If you get hit in a sport, how that can damage certain other things, how you run, how that hurts your knees over time, like just the progression, and it all comes back down to the airway.
It's amazing.
Yes, it's enhancing the performance of athletes. If you notice in the news, you'll see that a lot of these sports organizations are starting to focus on the sleep of their athletes.
Okay.
Right? So that's becoming a big thing. They're starting to look at when do they plan a game at this time versus this time. Are they traveling backwards, east across time zones, or west? They see all the differences, right? And losing sleep versus gaining sleep, and the ability to breathe through your nose. So doing athletic performance training that involves teaching them to breathe through their nose as opposed to mouth breathing.
Well, I mean, because for years you've also seen the nasal strips now on football players and all that coming to
open up those nostrils.
That's a great observation, and those are a big deal. And many coaches will train to run and only breathe through your nose now. So at least there's some awareness. This is the good news.
So with that in mind, again, looking inward with these conversations, I've been hearing and dabbling in the airway knowledge for a few years now. And so when I work out, I try to breathe through my nose, but I also have a lot of congestion. I have enlarged turbinates. Is that how you say it?
Turbinates, yep.
So what do I do? Like I can't sometimes. I get to a point where I can't breathe, and I have to breathe through my mouth. And so what do I do?
So you time it, you cycle it, and that's a great question, because when you're struggling with this, the natural tendency is to stop. So when we're training with anything, we're dieting, we're anything. So that's okay. It's not your fault, right? So cycle yourself. Say, I'm going to breathe 4 breaths in through my nose, and then I'm going to open my mouth slightly to breathe through my mouth. But we don't just stop doing it, because it's challenging.
And you gave us a clue earlier in this podcast, because you said you are a mouth breather during the day. So if during your normal routine you're breathing through your mouth, your nose is going to be inflamed. Now you want to go and work out, which the exercise is going to engorge those vessels even more, right? You have increased blood flow, increased everything. So the time to train for that is during the day when you're at rest. When you're working on your computer, tape your mouth. See how long you're able to go before you start to feel that sense of air hunger. And that will increase. And then you start to do some stuff around your house. So really, there's a progression of time to train yourself to breathe through your nose only, but you have to start it at a calmer rate. Then those turbinates will start to decrease, Okay, and
Because you're triggering them. You're like training them to kind of shrink back. Is that
well,
what's
the
happening? Or
inflammation starts to
is-
cut down. The more you breathe through your nose and not through your mouth. Again, you're looking at stress response. Breathing through your mouth, you're in fight or flight. You're releasing, inflammatory mark. When you breathe through your nose, you're rest and digest. You're calm. There's decreased inflammation. The other issue is that your brain cycles between right nostril and left nostril. So if you have a deviated septum, which goes back to, again, if that maxilla is not formed properly and it's high and vaulted, you're going to have a deviated septum. So you might have airflow on one side, but not on the other. So maybe you start out, as Cyndee said, you're exercising, you get good airflow here, and then your brain switches over,
And now
that
can't
side's
breathe.
occluded. So that's fine. Open your mouth and breathe through. I mean,
You need to breathe.
you need to breathe. But with arch development, with the expansion of that arch, what you're going to see is that septum will start to straighten out and things will go back to where they should be. So you're working in harmony with that.
To me, it sounds like airway is a lot like water. Like when you go through canyons and you go through, like, water will go and it will create, divots and,
Yes,
like,
exactly.
and it sounds like air, like if it is proper and your exchange, it creates that. It will
Yes.
inform. But if it's not, then it's going to
Yes.
cut through and ruin a city.
That's
So
a great analogy.
It is a great analogy.
Thanks,
and
Guy.
you think about those turbinates, right? And the role of those turbinates is to bounce that water into the little
Eddies. Into the eddies.
to mix with the nitric oxide, to go and do what it needs to do. So that's where we don't want to be disrupting those just for the sake of air to get into the brain.
Right.
It has to go through those motions. And where you have the turbulent airflow is where you get the enlarged adenoids and tonsils, just like we talked about. So visualizing air like water is perfect.
That is a great one.
Everyone's welcome to use it.
Why does
I
that have to
won't
leave the city,
trademark.
though? I don't know.
That's a weird city.
But you're not
She's
like
36.
It's like destruction. Leveling all
everything must die. But that's kind of what it sounds like to me. Like if it's going to find its way. Like you have to breathe, but it's just going. If you're doing it properly, things
Yes.
grow and everything's fine. But the moment it doesn't, that's when your whole systemic is an issue.
And so you end up with inflammation. Because if you're breathing properly, your respiratory rate should be low. You should be able to hear a person breathing. And you should have nice rise and fall off the chest.
Okay, let's talk about me now. So, what I've noticed, even doing podcasting, is there have been times when I've actually used the little breathe strips on my nose because I feel like the right side is only partially occluded. And so what I'm hearing is, even as an adult, there's still possibly non-surgical interventions
Good Lord, yes.
to get this fixed.
Absolutely.
Okay.
Absolutely. There's so many different devices. And maybe that's something we can show on. But yes, there's daytime ones, there's nighttime ones, there's sports ones. So my son has a significant septal deviation, and he plays rugby. And so there's little things that just go up inside, and you click, click, click to open the. You want to support the nasal vault. You need to look in the mirror and see do they collapse, or are they open? Can you breathe through? You try each side of your nostril to see which.
People are going to love listening to your stuff.
Yes. You hear that congestion?
This one even whistles.
It does. Do it again
I don't
on the
want
mic.
to. I don't want to on the
There's
mic.
a product. There's a company. It's not in the U.S. actually, that has a set, different size sets of developmental assistance.
Yes. Yeah,
You
and
can
so
get
you
those.
can tell a lot by looking at your patients, looking at their nose. And after you get into this, you'll see people, you'll be able to just identify people who don't use their nose. If you don't use your nose, it's going to start atrophying in ways that, and over time, becomes more pronounced, right?
Well, and I think this is just so great. It makes so much sense for hygienists to be looking at this, doesn't it? Like it just, we're sitting there staring down their throat. We're looking at their arches. how many times are we like, our loops just somehow make their way up somebody's nose? Like you can see everything with your lights.
Yes.
It just makes so much sense.
It does. It does. We're up close and personal, and we'll talk about it in another setting. There's so many reasons why, aside from lack of knowledge and understanding, but there's so many other reasons why we're not doing what we could be doing, and it involves timing and scheduling and expectations and responsibilities, all sorts of things. Those of us who are practicing hygiene understand the limitations that we are dealing with. It would be wonderful if we had 2 hours with every patient, or 2.5 on some of them. So what we're going to do is talk about some of the ways that you can sort of 80-20, if you will, your appointment, and pick the bigger chunks, knowing that we can pick up some of the smaller pieces at the consecutive visits.
And I just want to be sure that we cover, I know we're winding down, but cover the adult and senior.
Yes, please.
And because all these things we described that this child, the baby, the adolescent is going through, now we arrive at adulthood. And where we had compensatory mechanisms when we were younger, they start to break down. So we're in adulthood now, and we're seeing that we live in a chronic state of inflammation and stress. We start to see some of the degenerative issues starting to happen. Maybe our blood pressure starts to go up. We start to put on weight. We start to get issues with our sugar and our hormones and all of those things. And so this is where, and people just write it off as, I guess I'm getting older. This is what happens when you're older. It doesn't have to happen, though. So how do we support people at that stage that are having trouble coping with life? And we see them in your chairs, and they're on blood pressure medication, but you take the blood pressure and it's uncontrolled. And the tendency is for the patient to want to say, yeah, I know I should exercise more. I could be doing better with my diet. You know, they blame themselves. As medical providers, we blame them. You know, we look at somebody and we think, that person's not making good choices in their life, you know, or whatever, right? We've gotten into this cycle of it's all lifestyle choices and you're making poor lifestyle choices. Well, what we know now is the physiological stuff that's going on that's creating the imbalances. So we'll talk another time about how we broach that conversation, but what we could start to see is significant changes in their faces, starting to see asymmetries. Eyebrows and eyes don't align, ears are off, nose is starting to shift to one side, the jaw is off, maybe they favor chewing on one side. You know, we start to see a shift in the cranium, because if it didn't develop properly, then you know all those beautiful bones in there start to torque and adjust because of the improper growth and development. They're going to start to have the TMJ issues, the headache, the neck pain, the forward head posture throws off their whole spine. They're the ones with the back pain, the knee issues. Really, you just see this decline where we fall off the cliff, right? So can we still expand during that time? Yes, we can. Can we retrain people to breathe through their nose? Yes, we can. We can see huge changes when we work with people. It may not happen as quickly as it would have when they were a child, but we still are seeing significant improvements, and lives are changing. And we look at seniors, and we're starting to see that even in senior years, it is still worthwhile to do these treatments, because we're living. Not only are we trying to live longer, but we want to have the quality of our life fit that. We want to be as young as possible for as long as possible, right? And we can't do that if we're not oxygenating well, if we're not breathing well and having good restorative sleep. So, for adults, one of the issues with the appliances is going to be which one, right? So Michelle clearly dislikes certain ones. But you're going to look at, obviously, how much room is in the mouth, the appliance, how much stuff do we have to put in there? What is it made out of? Does your patient have a nickel allergy? Can you use the ones that have metal? Or does it have to be all plastic or all nylon? Do you how large is their tongue? Do they have a heavy, thick neck? You're going to use a stronger appliance. So all of those different things, and maybe what we can do, what I would like to do for your YouTube video is to put some pictures of some appliances and what their benefits are versus
That'd be great.
what are the
Yeah.
what are the what's the opposite of benefits?
I don't know. We only know benefits.
There you go, the pros and the cons. Yes. And then how do we keep them clean? So, some of the newer ones that you need a digital scan, for example, they're so custom made and so precise, and the material they're made out of is so much easier to clean than some of the older ones, right? So with an impression, you're not going to get as perfect fitting a device. Are you able to titrate? Do you need to leave room in case the person is a grinder?
Well, on that note, thanks for the segue, Julia. That was perfect. I wanted to mention one of the appliances that I know I've been guilty of over the years placing or suggesting in my patients' mouths. And one of the things that we see on a regular basis is a mouthful of wear. And so we say, you're a bruxer, and when we're doing our assessments and checking muscles, we know that. So what do? We make a big piece of acrylic, and we stick it into a space that's already overloaded with stuff. There's no room for their tongue and their cheeks, and their airway is suffering. So one of the things that I'd like to just, for widening the lens, is this a patient we would recommend a night guard on or a bruxing appliance, and maybe ask ourselves why. And if we look at the type of wear, so the anterior wear, how many times have you had a patient say, well, I don't put my teeth like that. How on earth can you do that? The mechanism with which the body uses to open the airway when we're choking ourselves to death is to stimulate and have that jaw thrust forward. So we're banging on those anterior teeth. And that's a classic sign of a patient who has an airway issue. So not only understanding why we're wearing the teeth down, but which ones, and being able to make an accurate assessment.
And the issue becomes if we're just handing out the guards to protect the teeth without addressing the airway issue, we could be making things way, way worse. And there was, they tried to do a study to show the effect of using those flat, plain night guards on obstructive sleep apnea, but it was making people so much worse that ethically they had to stop the study. They couldn't continue the study.
What?
Yes.
And think about the patients who don't, to add another layer to that, the ones that don't want the night guard, they'll just run and buy a sports guard or run to Target and get a mouthpiece that they can boil or make themselves. So the levels of exacerbation and danger to our patients are very real.
So so you said like when they are needing to open up their airway or something like that, push forward, that stimulation. But what about the clenchers, just straight clenchers? Is that kind of the same?
Yep. It's the same mechanism. Your brain is struggling to get that airway forward and then wants to lock it down into place.
Okay, so what they're doing is kind of posturing forward to open up their airway and then clenching down on that. So even when we're doing like occlusal adjustments, looking at the highs and lows of cusp, it's not happening, and that's like we're not looking at it when they are posturing forward in that nighttime position to open up their airway.
I think that's well said, Michelle. I think we're not looking for that. So what I'm taking from what you're asking is, are we looking for everything that we need to be looking for?
Right.
And therein lies the whole subject matter of these sessions.
Right.
Because yes, we have people who grind their teeth. Maybe there is some stress, but that isn't as high a factor as we once thought. The other thing is, are the teeth in their proper position? And that's a completely different story, because our body, the mechanism of our body, if we aren't in a comfortable position, darn it, we're going to find a way to get there. Think about mixed dentition in children, and we hear them grinding at night.
Yeah.
Well, it could be an airway. We're certainly going to assess that, but is it just the mixed dentition in our body going, where's the comfortable place to land? So being able to look at the where it is happening, look at the airway, look at the structures in the mouth, and make that assessment accurately is really what this is about.
I just saw I kind of, in episode 1, we talked about like how I jokingly said it was kind of a buzzword, airway, right? And it kind of stemmed from a conversation I just saw on Facebook where somebody fractured I think it was like an Emax crown. No, maybe not. Some like a crown or a veneer. And the joke within the thread was Airway.
Yes, I see those too. And that's unfortunate. And there are some groups on Facebook that are, I call those the release valve. I think that a lot of people that are just being naughty or releasing
they got a vent
steam,
or
they
something,
got a vent. I'm going to leave it at that. Because there's some very real reasons
Truth to that. Like they could have fractured that because of Airway.
Think about the cascade effect of that. And Julia spoke to that earlier. So we have patients who are grinding or thrusting their jaw. Let's leave the breathing aside for just a moment. And we have fractured teeth, and we're losing teeth, and we're putting implants in, and we're fracturing implants. We have patients who are fracturing implants. We're losing implants because of that. And Michelle, I know I'm preaching to the choir here, but it's such a domino effect. And again, taking it back on the timeline and asking ourselves, hey, we get our patient when we get them, right? So it's our responsibility at whatever point that is to accurately assess.
Yeah, and I guess I'm sitting here thinking, do I comment on that or do I not comment on that? But I think when you look at the, the stages of change, whenever you're changing society and basically incorporating Airway into all of medicine, and medicine including dentistry, there's the change factors we have to go through. So people initially deny, ignore, then they mock, ridicule, and attack, and then they assimilate, and then they accept it. So we're in those phases is all what I would like to say for that. Those people are uneducated, uninformed, unfortunately, and so we stay our course. We continue to educate and inform, and just like our patients, it will take multiple times of approaching some people with the topic. And many times it's not until they experience it themselves or for a loved one. That which is why we really encourage. So as we're talking to you and you're thinking about yourself, we really encourage that.
Right.
We're teaching people, we want everybody to first address themselves and their own issues, and then their loved ones, and then their patients. Heading back to the seniors for a second.
Yeah, I would love to finish up with that.
Yeah, I do want to touch on the fact that Airway is important up until it isn't. If we can change and improve Airway, we do it until we can no longer do that. So looking at seniors, sometimes people hesitate and think, I'm not going to bring it up because they're already however many years old, and it would mean expansion, or it would mean a couple implants to be able to hold an oral appliance device or something like that, and they assume for their patients that they're not going to be interested. But the population that we see now, they want to have those options. They want to feel good for as long as possible. We talked about that, but also for those ones who don't know. So the people who are showing signs of dementia and Alzheimer's. I did hear a story about a lady whose husband started to have memory issues. He declined over about 2 years. He started to rapidly decline to the point where she took him to work with her, and she would have to sit him in front of her desk because he would wander. So he would just sit there and stare off into space, and she would work. And she went to every doctor, every test, and they couldn't figure out what was wrong. CT scan showed nothing, MRI showed nothing, and she just they thought he had Alzheimer's. And so somebody suggested to her finally, have you ever had a sleep study? As like an offhanded, I don't know what else to test. They did his sleep study, and he was severe sleep apnea with major desaturations. They put him on CPAP and eventually transitioned him over to combo therapy, which is a CPAP and an oral appliance. And he is back to work today.
What?
He is back to work. So what I'm saying is that we have to advocate for our loved ones and not just assume the changes we're seeing in people as a result of natural. If you're listening to the podcast, air quotes. Natural aging. Because there's nothing natural about losing your mind as you age. There's nothing natural about it. So we have an opportunity to really impact a lot of people from infancy right up to senior years. We know the earlier we intervene, the better it will be for people. Seniors, they're not going to recapture everything that they lost, but they can certainly slow decline and they do regain much of what they lost, but it's still worth every attempt that we can offer.
So we have, again, just barely scratched the surface of the different stages of life and the development and how it relates to Airway. But if our listeners wanted to dive more deeply and want to reach out to you for more information about that, how might they do that?
cyndee@scalartoschedule.com. And I spell my name differently. It's Cyndee.
And you can reach out to me anytime, Julia.worrall at airwayhealth.org.
All of this will be in the show notes, and I hope you guys stay tuned for episode 3, where we're going to really kind of delve into the hygiene-driven, centered, airway-centered care, and talking about how we educate ourselves. Is that correct?
Yes, we're definitely diving into that as well.
Awesome. All right. Thank you, guys.
Thank you.
Thank you.
Well, I'm sure you were not disappointed. I mean, each week it's just going to get better and better, guys. It really is. We also want to thank PDT for sponsoring the CE portion of this. If you haven't picked up their instrument, tried their Gleason guide, slap yourself. No, I'm kidding. But really
But really do.
but really do.
But just kidding.
You won't regret it. You won't regret it. Really great stuff. And PDT is just an amazing company run by awesome, awesome people. So support them because they support us.
And I think also, just piggybacking on that, we have some really amazing things going forward here in the new year that PDT is supporting also. So we have a new segment that's coming out called something. we don't
I was going to say, what is it called?
I started talking myself into a corner there for a minute. It's called something about, but basically it's a student roundtable. It's a roundtable of clinicians who are speaking directly to the students. And PDT has really embraced that endeavor. And so they're going to be sponsoring those particular episodes as well. So it's not just that PDT has great instruments and great products and great people, but they are actually investing their time and their money into education for students and experienced clinicians alike. So really give them all of your love, because, these types of companies, it's not about the bottom line for them. They're really invested in you as a clinician too.
Seriously. And don't forget to send us your messages. You can do that on Facebook at A Tale of Two Hygienists in Facebook Messenger, or you can direct message in Instagram. We love the interaction on social media. Tag us, share us, all that fun stuff. We really appreciate it. And you can also check out our website at taleoftwohygienists.com and send us an email at ataleoftwohygienists@gmail.com. Don't forget to head over to iTunes and review us, subscribe, share, all those things, and give our guests some love. If you love their podcast, let them know it.
I agree. All right, everyone. Have a great week.
Bye, y'all.
Bye.